Welcome to the House Committee on Corporations. Today is Tuesday, March 16th. We're in room 35 of the State House. Will the clerk please call the roll?
Chairman Solomon.
Here.
First Vice Chair O'Brien.
Here.
Second Vice Chair Caldwell.
Present.
Chairman Casey. Whip Chippendale.
Present.
Representative Fenton Fung.
Present.
Representative Hawkins.
Present.
Whip Kazarian.
Present.
Speaker Pro Tem Kennedy.
Present.
Deputy Speaker Lima.
Present.
Representative Stephen Lima.
Present.
Representative Phillips.
Present.
Representative Potter. Present. Chairwoman Serpa. Representative Shallcross Smith. Present. Chairman, there is a quorum.
Thank you. We have 23 bills on the calendar today. First bill we will take up is by Representative Edwards, 5276, an act relating to the health and safety, the Rhode Island Cesspool Act of 2007, which would allow DEM to extend certain deadlines for required sewer construction and the replacement of cesspools, which deadlines would not extend beyond January 1st, 2026. There's a motion for passage made by Speaker Pro Tem Kennedy, seconded by Representative Hawkins. Is there discussion? Seeing there's no discussion, all those in favor signify by saying aye with a roll call.
Chairman Solomon.
Aye.
First Vice Chair O'Brien.
Aye.
Second Vice Chair Caldwell.
Aye.
Whip Chippendale.
Aye.
Representative Fenton Fung.
Aye.
Representative Hawkins.
Aye.
Whip Kazarian.
Aye.
Speaker Pro Tem Kennedy.
Aye.
Deputy Speaker Lima.
Aye.
Representative Stephen Lima.
Aye.
Representative Phillips.
Aye.
Representative Potter. Aye. Representative Shallcross Smith. The motion passes 13-0.
5276 passes and goes to the House floor.
Calvin,
Next bill, we have Senate Bill 148 by Senator Miller, an act to vacate the forfeiture or revocation of the charter of Providence Riverboat Company. Is there a motion for passage?
Motion.
Made by Whip Kazarian, seconded by Vice Chair Caldwell. We'll take a roll call.
Chairman Solomon.
Aye.
First Vice Chair O'Brien.
Aye.
Second Vice Chair Caldwell.
Aye.
Whip Chippendale.
Aye.
Representative Fenton Fung.
Aye.
Representative Hawkins.
Aye.
Whip Kazarian.
Aye.
Speaker Pro Tem Kennedy. Deputy Speaker Lima.
Aye.
Representative Stephen Lima.
Aye.
Representative Phillips.
Aye.
Representative Potter. Aye. Chairwoman Serpa.
Aye.
Representative Shallcross Smith. Aye. Motion passes 14-0.
Or is there a motion to hold the remainder of the bills for
So
further
moved.
study?
Second.
Made by Representative Phillips, seconded by Vice Chair Caldwell. Will the clerk please take the roll?
Chairman Solomon.
Aye.
First Vice Chair O'Brien.
Aye.
Second Vice Chair Caldwell.
Aye.
Whip Chippendale.
Aye.
Representative Fenton Fung.
Aye.
Representative Hawkins.
Aye.
Whip Kazarian.
Aye.
Speaker Pro Tem Kennedy. Deputy Speaker Lima.
Aye.
Representative Stephen Lima.
Aye.
Representative Phillips.
Aye.
Representative Potter. Aye. Chairwoman Serpa.
Aye.
Representative Shallcross Smith. Aye. The motion passes 14-0.
All right, so the remainder of the bills are held for further study. The first bill we will take up is 5898 by Chairwoman Bella Wilkinson. This would provide health care coverage for laparoscopic removal of uterine fibroids. Chairwoman?
Thank you very much, Mr. Chairman and members of the committee. I'm here this evening to speak to you on behalf of House Bill 5898. Over 1/3 of women develop fibroids by the time they reach the age of 50. Fibroids are most common in women in their 40s and early 50s, but not all women with fibroids have symptoms. Uterine fibroids usually appear in women of childbearing age, generally between 30 and 40 years old, but they can show up at any age. They're more common in African American and Caribbean women than in white women, and they also tend to show up earlier and grow quicker in African American women, but doctors don't know why that is. Treatment options include a hysterectomy, radiation, and hormone therapy. In Rhode Island, a hysterectomy costs between $5,000 and $13,700, and it's covered by insurance. But a hysterectomy is extremely invasive, painful, and although generally released after 2 to 3 days, full recovery is typically 6 to 8 weeks. Approximately 39 states, including Massachusetts, cover another procedure to remove fibroids. It is significantly less invasive. Laparoscopic hysterectomy costs approximately $5,791 in Providence. Most patients are cleared to go home within 2 hours and may resume their daily activities in 4 to 5 days. This procedure has been in existence for over 20 years and is FDA approved. More than 156 million women nationally are covered for this surgery, but not if they live in Rhode Island. And House Bill 5898 would change that. I thank you for your attention.
Thank you. Are there any questions for the sponsor? Seeing none, thank you. And that concludes the testimony on House Bill 5898. Next, we will go to House Bill 5897 by Chair Bella Wilkinson. This would require insurers to provide coverage for any prescription drug treatment for Lyme disease. Chair Bella Wilkinson.
Thank you very much, Mr. Chairman and committee. I'm also here this evening in support of House Bill 5897. Lyme disease is the most common vector-borne disease, that is, a disease transmitted by mosquitoes, ticks, or fleas in the United States. In recent years, approximately 20,000 to 30,000 confirmed cases of Lyme disease per year have been reported to the CDC. Because the CDC states that Lyme disease can be treated with 30 days of antibiotics, the majority of insurance companies do not recognize chronic Lyme disease as a legitimate illness and will not pay for long-term treatment. It's clear that we need effective and cost-effective and compassionate management of these patients to improve their outcomes, even if we don't know what to call the disease. When diagnosed early on, Lyme disease can usually be treated with a short course of antibiotics. In other cases, the disease can leave lingering symptoms, including fatigue, muscle and joint pain, and/or cognitive impairments. The severity and cause behind those lingering symptoms is at the root of a never-ending debate within the medical community. While some physicians refer to persistent symptoms as post-treatment Lyme disease syndrome, which requires no further antibiotic treatment, others have termed it chronic Lyme disease and believe antibiotic treatment beyond the 30-day regimen may be required. The severity of chronic symptoms post-Lyme disease treatment and the size of the patient population affected may be vastly underestimated. When compared to CDC estimates, the Johns Hopkins researchers found a significantly higher percentage of patients suffering from persistent symptoms following a standard course of antibiotic treatment for Lyme disease. In fact, the study found 63% of those treated reported at least one related diagnosis, a rate 36 percentage points higher than those who did not have Lyme disease. Whereas the CDC reports 10 to 20% of patients experience lingering symptoms after completing 2 to 4 week antibiotic regimens for Lyme disease. Researchers also report individuals with Lyme disease were 5.5 times more likely to have a diagnosis of debility and excessive fatigue. And within the year following the Lyme disease diagnosis, patients had 87% more visits to the doctor and 71% more visits to the emergency room than matched controls. Lyme disease imposes an economic burden that could be considered significant in the United States and other developed countries to justify further research efforts in disease control and management. The societal cost for Lyme disease can be equally impactful as health care costs, but they're not fully understood. Patients with early Lyme disease incur approximately $3,798 of total direct medical costs. But late and chronic Lyme disease, the total annual cost per person is approximately $25,000. So you can understand why this bill would be important to many of our constituents in the state of Rhode Island. I urge your support. Thank you.
So you would say an ounce of prevention is worth a pound of cure?
It's certainly going to cost longer in the long run with related health care costs if we don't get this under control. Absolutely. Thank you, Mr. Chairman.
Thank you for your testimony. Are there any questions for the sponsor? Representative Fenton.
Thank you, Chairwoman. Chronic Lyme disease is a huge issue around here, and I have several friends. And it's interesting, there's actually a big specialist in D.C. where many Rhode Islanders go, and they try a lot of these protocols. Okay, there's very different protocols with the antibiotics and whatnot. There tends not to be one size fits all, and we understand that given the course of the disease. My question for you is, where is the AMA on this bill? Or on just being for approval of long-term antibiotics in general? Do you know?
No, Representative, I can get that information for you. I will tell you, for those individuals who have the chronic Lyme disease, it's very difficult to find a physician that treats chronic Lyme disease as an actual disease. And although it's debilitating, it's not recognized as a disability.
Yeah, and unfortunately, they go through a lot of people like rolling their eyes at them, like, oh, you're making this up. And we know there's a lot of sequelae of Lyme disease, and it's being, I think, better recognized. And you're right, these people wouldn't have to fly to D.C. all the time if there was somebody locally who treated that. I just get concerned when it's very broad language like that, like any prescription drug. I just think there could also be a lot attributed to Lyme. That's a very broad statement to make. Considering the different protocols, I think it just needs to be like quote unquote approved for Lyme, or at least in some type of study. Otherwise, I think there's some potential for misuse, especially when we're experimenting with different protocols. That'd be my only feedback on that. But I so appreciate you bringing this forward and getting the idea of chronic Lyme and management of it under our skin. So thank you.
I'll tighten the language up. Thank you for the suggestion.
Thank you, Representative Chippendale. Whip Chippendale.
Thank you, Chairman. And thank you for introducing this piece of legislation. Where I come from, we're known to have a tick or two. Having dealt with this on a different level, certainly not on this level, this is, I think, is a good jumping off point. Even with your language, it is dictated by Chapter 37.5 of Title V, which is the Lyme disease diagnosis and treatment chapter, which does have some guidelines. But I wonder now that we're learning, especially with the ongoing rift in the medical community, and you alluded to it, but I'll say it straight out, there are two camps, and there's no DMZ between the two of them. It's just they're so far apart. How would this impact? We've learned that there are some other tick-borne diseases. Babesiosis is one I remember. There's 2 or 3 others that I can't recall the name of. But we've learned that oftentimes when doctors are doing the blood work, they can say, well, you have a tick-borne disease, but we can't tell you for certain whether it's Lyme or babesiosis or whichever it is. Would this allow for treatment of any tick-borne disease? It's very specific because obviously it says it's under the chapter of mandatory coverage for certain Lyme disease treatments, but would you think that would fall under an umbrella? Is there one, or have you not dug that deep into the chapter?
No, Representative, I haven't gotten that far deep into the chapter, but I'll take a look at that.
Yeah, I just think it's because of, the rift in the medical community and the strong camps that have evolved. I think that it's due, the time is due for us to have a little bit more latitude for patients, because there are so many people who do not recover from an initial diagnosis of Lyme disease with one course of doxycycline. Just doesn't do it. It takes years in some cases for people to test negatives. So I'm glad that you put it in. I'm hopeful that it'll develop further to help more people. Thank you very much.
Thank you. Thank you very much, Representative.
Whip Kazarian.
Thank you, Chairwoman Bella Wilkinson. I just want to commend you for this legislation. I have a very good friend that I went to elementary school with, actually, still a constituent, and he contracted Lyme disease, I think it was about 7 or 8 years ago, and he's still dealing with the effects. And the medication that helps him the most was not covered, and him and his family had to pay it out of pocket. So I'd be actually happy to put you in touch with him after this, but I just want to commend you again for this legislation. I think it's really important, and it does affect a lot of people. Thank you.
I would definitely appreciate you putting me in touch with him. Thank you very much for that offer.
Thank you, and that concludes the verbal portion of this bill. We did receive written testimony against from the AHIP, as well as written testimony against in regard to the last bill from the AHIP. And that concludes the testimony on House Bill 5897. Next up, we will go to Representative Shanley's bill. Representative Shanley, you have two bills here today, 5900 and 5901. So we will take those two bills together. Would you like to describe them?
Sure. Thank you, Chairman, and members of the committee. The aim of these two bills is pretty simple, is to find a mechanism to require healthcare networks in Rhode Island to cover treatment with naturopathic physicians. Back in 2017, we allowed for the licensing of naturopathic physicians, and that's great. There's a lot of them now, but the problem is that the treatment is just not affordable for most people. And to kind of dovetail on the theme started by Whip Chippendale during session today, I had some digestive health issues back when I was in my early 20s and went to a doctor, was given acid reflux medication after a literally 30-second visit and just told to keep taking it for 10 years. And it masked the symptoms for a little while, but it caused a whole bunch of other health issues. And after seeing two different gastroenterologists and going for every kind of testing that you can imagine under the sun, I just kind of gave up and figured I was going to be uncomfortable for the rest of my life. But when I came up here, I got connected with a naturopathic physician by Representative Phillips, who happened to be doing some lobbying. And I said, well, why not try it? So after some tests that I did with them, I figured out that I did not have acid reflux at any point. I actually had low stomach acid, and the damage that was caused to my stomach and my intestines was intense, and it required years of altering my diet and taking various supplements. And treating with a naturopathic physician has allowed me to completely get off prescriptions. I don't have to go for any more expensive tests, and just healthier and feel better. But the benefits of this have come at a significant financial cost. Thousands of dollars every year out of my pocket. And that's not a cost that most people can afford. So there are 5 other states that have found a mechanism to require private health care providers or insurance companies to allow for coverage for naturopathic treatment. So these two bills in conjunction seek to do that. Fortunately today, after the bill was introduced, the American Association of Naturopathic Physicians reached out, and they have some suggested language that would allow us to get around some of the requirements of the Affordable Care Act that make it mechanically difficult to enforce the requirement of HMO networks to cover naturopathic treatment. So I anticipate that there are going to be some significant amendments, but I've heard from an overwhelming number of people on this subject, and I've yet to speak with anybody who does not see a lot of validity and benefits, particularly during a pandemic, to trying to get our population healthier. And I think that's what naturopathic care does. It gets our population healthier and is of particular and significant benefits for people dealing with chronic diseases and illnesses. So I had a lot of witnesses. I tried to coordinate them to submit verbal testimony to respect the committee's time. I do have a couple of naturopathic physicians that are going to testify. Dr. Kazantis submitted 8 pages of testimony, and she's been working really hard to get her verbal testimony down to about 2 minutes on each one of the bills. So she's an expert, and she's going to be able to answer questions. As far as the technical language, I would like to work with you, Mr. Chairman, and anyone else that's interested on making any necessary revisions, and I'm hopeful too that we'll hear from other representatives from healthcare providers or the state or any other entity that might have some suggestions on what we need to do from a technical perspective. So thank you very much.
Thank you, Representative. Are there any questions for Representative Shanley? Seeing that there are none, if you could just hold for one moment, I'm going to lead to Charlie Knowles, our legal counsel. If you could just provide a brief description to the committee in regard to insurance coverage.
Actually, if Speaker Pro Tem Kennedy were here, he'd probably jump in and say what I'm about to say. Since the Affordable Care Act went through, Obamacare, the edict at that time was the Fed said, tell us what your mandates are, and they can continue to be covered prospectively. Any new mandate that you put forth, the cost for that has to be borne by the state. If this American Association of Practitioners,
Yes, so what, so this,
if I can finish?
yeah, sure.
If they have suggestions as to how to get around that, that's great. But since that edict went into effect, I think we passed one bill in the 12-odd years that I've been involved with this. And that was because what was mandated actually cost less than what was already covered. So that the Fed said, okay, you can do that.
So I'm going to request Chairman Shanley to work with legal counsel in finding a way to get around that.
Sure, I can explain it in about 15 seconds. The way to get around it is there's a section of the Affordable Care Act called the Provider Non-Discrimination. It's PHS Act Section 2706A, and it requires that everybody be allowed to choose the providers that are in their network. So naturopathic physicians can bill at the same billing codes that traditional physicians can bill at. So it's just that we're not including them in our network. And under regulations issued by the Department of Health, we are allowed to pick the physicians that are in our network and that are included. So we have a mechanism to allow for them to be licensed, and I'll have more, and I'm happy to work with legal counsel, but legal counsel is absolutely correct. It was Representative Kennedy who raised this with me and allowed me to get this additional information. And we have 3 of our neighbors in New England that are doing it. So there's a way to do it, and I hope to have more information soon on that.
That'd be great. So if you could work with legal counsel on this. Charlie, do you have something to add?
If I may, I'm assuming, therefore, that is why in the bill they're changing them from doctors of neuropathy to naturology to naturopathic doctors. I'm assuming that's why they're changing the change in title, so now they're becoming the equivalent of physicians.
So we can put you two in touch, and we'll go from there. Representative Fen Fung.
I have a question for both of you, actually, and you guys might not know. Can you actually use your health savings account for naturopathic treatments right now?
Yes.
Okay, thank you.
Whip Chippendale.
Thank you, Chairman. And thank you very much for introducing this bill. And while I can't speak to the technicalities as our learned legal counsel, Mr. Knowles, just did, I can say this, and I don't know your particular situation. However, oftentimes, especially when it is, and seeing we're talking about this all day, evidently, in the case of Crohn's or colitis, a lot of times the knee-jerk reaction, regrettably, in a good portion of the medical community is to say, okay, you're going on Remicade or Humira or Entyvio or any number of these biologic agents which cost upwards to $3,000 an injection. I overcame my Crohn's disease with naturopathic and dietary changes. And I can assure you that the cost was far less than several $1,000s per injection. So if that's the only barrier, Attorney Knowles, I think we may be able to hit that with this one, because there are ways, and you're absolutely right. The initial course or the regimen that's typically given to a person who presents with any sort of an inflammatory bowel disease is pretty aggressive. It includes high-dose steroids, it includes biologic agents, it includes sometimes chemotherapy, although they have gotten away from that over the years as some of the biologics have come online, all of which are extremely expensive, all of which mask other issues. Prednisone itself causes a wealth of issues. I think we're an actual case study to be done on this, if it hasn't been done already by the Crohn's and Colitis Foundation of America. We would be surprised, I think we may be surprised to learn that it's cheaper to probably take the naturopathic route. And I'd be happy to work with you on this, or anybody else in that sense as well, because I think this is a worthwhile endeavor. Absolutely.
If you look at the testimony submitted by Dr. Kazantis, and it's available online, in the state of Washington, patients that utilize, they call it complementary alternative medicine, save an average of $356 a year over somebody that does not. So the savings have already been demonstrated in the state of Washington.
Does not surprise me at all. So I think this does have a chance, and maybe with some tweaking of language, we can get this across the goal line. Thank you very much, Chairman.
Thank you, Whip.
Looking forward to working with you on trying to get that. Are there any other questions for the sponsor? Hearing none. We'll go to the witnesses. So on House Bill 5900, we have Dr. Kazantis. Doctor, before you go forward, Chairwoman Serpa, would you like your votes recorded in the affirmative?
Thank you, Whip.
What is it?
So ordered. Dr. Kazantis, you're here before the House Committee on Corporations. You may proceed with your testimony.
Okay.
And I would ask if you could just lower the volume in the background as well.
Okay. Good evening, Chairman Solomon and House members. Thank you for giving me the opportunity to speak to you tonight in support of both House Bills 5901 and 5900. My name is Dr. Crisante Kazantis. I go by Dr. Kaz, and I'm a naturopathic doctor. I am the president of the Rhode Island Association of Naturopathic Physicians and the owner and founder of Anasa Personalized Medicine, a naturopathic clinic located in Providence. Naturopathic doctors have been licensed in Rhode Island since 2017, and since then we have seen a dramatic increase in interest in our services. We are experts in evidence-based and effective natural medicine and treat all types of health conditions, including thyroid conditions, high cholesterol, high blood pressure, diabetes, Lyme disease, chronic digestive conditions, and much more. Many patients are seeking this type of medicine to support their overall health. They are interested in lab testing to determine vitamin and mineral deficiencies, interested in determining what is the best food to eat for their body, what the best supplements are for them, and discovering the underlying cause to their health conditions. Many people are sensitive to medications and want to minimize taking prescriptions or avoid surgeries and would like to utilize a natural approach to support their health. By providing these types of services, we are providing the patients and citizens of Rhode Island an alternative option to support their overall health. Currently, patients have to pay out of pocket for these services, which prohibits many people from accessing this type of health care, and for many, this is unaffordable. Therefore, many patients travel out of state to find a naturopathic doctor who is covered by their health insurance for office visits and lab testing. I witnessed this firsthand while practicing in Connecticut, as I had many patients who traveled from Rhode Island to see me, as their health insurance covered their visits and lab tests. At this time in New England, there is insurance coverage in 4 states, Connecticut, New Hampshire, Maine, and Vermont, and patients are very willing to travel outside of the state. This negatively impacts the clinics in Rhode Island and the taxes collected by the state. According to the CDC, chronic disease such as heart disease and stroke, cancer, and diabetes are the top causes of death in the United States. Currently, 6 in 10 adults in the U.S. have a chronic disease, which is costing the healthcare system $3.8 trillion annually. These chronic diseases lead to a significant burden on the healthcare system by leading to hospitalizations, long-term medication use, and continued doctor's visits. Naturopathic doctors use natural therapies, including recommendations for nutrition, lifestyle, and supplements, including herbs, vitamins, and minerals. These are all cost-saving ways compared to surgeries, hospitalizations, and medications, which is a greater expense to the insurance companies. Corporate health management programs associated with prevention and wellness demonstrate a 26% reduction in healthcare care costs and a $6 return for every $1 invested. One study that reviewed the efficacy and cost effectiveness of integrated medicine estimates that changes in lifestyle and stress reduction, a major focus of naturopathic medicine, could save the U.S. $10 billion annually and reduce coronary angioplasty procedures and coronary bypass operations alone, and result in an insurance saving of almost $30,000 per patient. I have attached additional studies on cost effectiveness on diabetes, lower back pain, anxiety, and cardiovascular disease in my written testimony. In a country with ever-increasing rates of chronic disease and preventable illnesses, investing in naturopathic medicine is a smart choice. In addition, naturopathic doctors work closely with primary care providers and other health specialists to discuss the best treatment options for their patients. Many medical doctors are grateful for this collaboration as they have many patients seeking this type of health care. Thank you very much for your time and consideration, and we look forward to your passing of HB 5901. In terms of HB 5900, we would like to ask you that you approve some minor changes to our licensing bill in order to more accurately reflect our title, training, and expertise. We would like to make an amendment on page 4, section 5-36.1-18, titled Informed Consent and Disclosure, line 20 through 24, to be struck and replaced with the following language: naturopathic doctors are not licensed to prescribe drugs.
Doctor, if I could stop you for a moment, did you provide written testimony as to the suggested changes?
Yes, I did.
Okay. Well, we'll review them. Yeah, if you could just briefly describe them.
The amendments?
Yes.
Yeah, so in page 4, section 5-36.1-18, informed consent and disclosure, line 20 to 24 to be struck and replaced with the following language: naturopathic doctors are not licensed to prescribe drugs.
Okay.
Currently in our bill, a formal consultation agreement with a medical doctor is required. With our comprehensive 4-year postgraduate training, we are adequately equipped to treat patients independently. To the benefit of our patients, we work closely with primary care providers and other health specialists to discuss the best treatment options for their patients. Many medical doctors embrace naturopathic doctors as a collaborative member of the integrated healthcare team to provide all options to their patients for the best healthcare outcomes. This requirement discourages new naturopathic doctors who are hoping to practice here in Rhode Island and limits the access to new naturopathic doctors in Rhode Island. Lastly, through our bill and licensing statute, the language of Doctor of Naturopathy is used. This language differs from the title that is used in all other 49 states in the country. Upon graduation, our medical degrees are listed as Doctorate of Naturopathic Medicine, and we are given the title in licensed state as Naturopathic Doctor, ND. The current title of Doctor of Naturopathy is inconsistent with every other state and confusing to the general public and community, as we are known in all other states as NDs, or naturopathic doctors. Thank you very much for your time and consideration, and we look forward to your passing of HB 5900.
Thank you for your testimony. Are there any questions for the witness? Seeing none, thank you for your testimony. We do have House Bill 5901, other people signed up to testify, but I just want to go through really quickly. For House Bill 5900, we received over 30 written testimony from 30 people in favor of this bill. I believe we're still receiving them, and they all will be posted on the General Assembly website. So in regard to House Bill 5900, the hearing is concluded on that bill. In regard to House Bill 5901, we will take up Catherine Diorsi. Catherine, you're before the House Committee on Corporations. You may proceed with your testimony.
Wonderful. Thank you. Can you hear me okay?
We can.
Great. So good evening, Chairman Solomon and House members. Again, my name is Catherine Diorsi, and I live in West Greenwich. I'm thankful for this opportunity to testify in support of House Bill 5901. As someone who's been in healthcare for 20-plus years and has been a patient myself, the approval of this bill is critical to the health and well-being of Rhode Island community, especially given the present pandemic. My educational and professional background is in traditional healthcare. I have a master's degree in physical therapy and have worked for the pharmaceutical biotech industry for over 20 years. I have trained many medical doctors and experts on pharmaceutical products, and many healthcare providers are my friends. I share all this because up to this point, I knew nothing about naturopathic medicine. Little did I know, in 2016, my entire world would be turned upside down. After 3 days of massive stomach pain, I drove myself to Rhode Island Hospital. I was admitted for 3 nights and eventually diagnosed with severe Crohn's disease. It was now my turn to become a patient, to experience our healthcare system and the medications I had been representing for decades in the pharmaceutical industry. Given my severe disease, I was put on an IV medication, or biologic as it's called, and this was the gold standard for my condition. At the end of 1 year of being on treatment, United Healthcare spent $373,000 on my care. Unfortunately, this gold standard medication had zero effect on my condition. The only thing it did do was it gave me a side effect, and now my liver, which was completely normal in the beginning, started to become inflamed, and my liver enzymes were rising. So here I wasted a year, and I was still very sick, and I needed to make a switch. In 2018, I discovered naturopathic medicine. I was unaware of this profession and surprised to learn the extensive medical training they go through to graduate, just like a primary care physician, as well as being experts in nutrition, homeopathy, supplements, and lifestyle management, all of which the medical doctors are not trained in this area. Thankfully, I found a naturopathic doctor who worked down the road in Putnam, Connecticut, Dr. Kaz, and their practice took my insurance. Through personalized lab and food sensitivity testing, all of which I never received in our Rhode Island traditional healthcare system, she discovered I was sensitive to so many foods, my stress hormones were depleted, and I had a major imbalance in gut health. All of this contributed to the massive pain and inflammation I was having in my stomach. So I talked to my gastroenterologist, and we discussed my desire to try this naturopathic approach. He agreed to support me on this complementary form of healthcare. He stopped that medication, and in 2018, I started to work with Dr. Kaz. After 1 year of getting off that medication and starting my naturopathic journey, I saved United Healthcare $66,711. And this included a necessary surgery I needed to have, putting me in Rhode Island Hospital for 4 nights. So in 1 year, I had a 39% reduction in healthcare, and I started to feel better. In 2019, Dr. Kaz then transferred her practice to Rhode Island to be closer to home. So given the success I was having, I wanted to stay with her. To my surprise, though, naturopathic medicine was not covered by insurance. But thankfully, I was able to afford the out-of-pocket expenses for this much-needed form of healthcare. And although it was expensive, I was willing to pay knowing we were on the right path and we were getting to the root cause, and I wouldn't need it for the rest of my life, unlike the other medication I was on.
Thank you.
I knew, and at the end, I will just say, at the end of that second year, I saved United $89,000, an 85% reduction, and all of these patients in Rhode Island are not getting this opportunity. And so I greatly ask that you support this complementary practice so that we can help the health and well-being of Rhode Islanders.
Thank you for your testimony. Are there any questions for the witness? Seeing none, thank you. Next, we will take up Christine Waldeck from the Rhode Island Wellness. Christine, you're before the House Committee on Corporations. You may proceed with your testimony.
Oh, good evening, Chairman Solomon and members of the Corporations Committee. Thank you so much for your service to the people of Rhode Island. Thank you, Representative Shanley, for sponsoring this important bill, and thank you to all the co-sponsors. My name is Christine Healy Waldeck. I am a Rhode Island parent and co-founder of the Rhode Island Wellness Society. I strongly support H. 5901 and 5900, a bill that would require health insurance contract plans or policies to provide coverage for the licensed practice of naturopathic medicine. We at the Rhode Island Wellness Society are very aware that the path towards optimal health and wellness has always been and will continue to be a continuous journey, especially during these unpredictable and unfamiliar times with COVID-19 and the ever-morphing variants. One need that remains constant, and fulfilling this need is more important now, more than ever before, is the need for Rhode Islanders to be able to seek, find, and have access to healthcare services, protocols, and therapeutics that are safe and effective for their specific physical, physiological, biological, and genetic makeup. We are acutely aware and have learned from experience that medicine is not a one-size-fits-all protocol. We have learned the hard way that a cure for one person can be a poison to another. All Rhode Islanders, all human beings, have the inherent right to be able to choose the type of health care that is known, safe, effective, and beneficial for their own individual bodies. All Rhode Islanders should be able to have access to naturopathic care and should be able to use their health insurance to seek recommendations from a naturopathic doctor. I implore the committee to please pass H5 901 and H5 900 tonight, and to help make access to naturopathic doctors easier and more affordable for my family and for all of our fellow Rhode Islanders. Thank you so much for your consideration, and I've also emailed a statement that detailed a little bit more about our personal experiences.
Great. Thank you so much for your testimony. Are there any questions for the witness? Seeing none, thank you. Chairman Casey, would you like your votes recorded in the affirmative?
Yes, if I could be marked as present and recorded to hold the bills for further study, as well as the two bills we had for consideration in the affirmative, please.
So ordered.
Thank you.
Next, we will go to Madalena Sirignata. Madalena, you're before the House Committee on Corporations. You may proceed with your testimony.
Hi, my name is Madalena Chirignota, and I strongly support House Bill 5901 because it would make high-quality naturopathic care available to families who cannot otherwise afford it. I believe that there is a time and a place for many medical modalities that all contribute to our health and well-being. Allopathic, osteopathic, chiropractic, and naturopathic health care all have a place in our toolbox. Thank God that we have allopathic medicine to care for us after injuries and accidents. Chiropractic health care has greatly raised my quality of life. Fortunately for me, my health insurance covers a certain number of annual chiropractic visits. I would dearly love to access high-quality naturopathic care. However, I'm a public school teacher, and naturopathic care is not covered by my insurance. I simply cannot afford naturopathic care for my family. Sadly, many families cannot afford to pay out of pocket for health care. As a result, naturopathic care is often a luxury for those with means and inaccessible to the average citizen. By allowing licensed naturopaths to bill insurance companies, families like mine would be able to access such health care, which would no longer be exclusively available to more wealthy Rhode Islanders. I urge you to promote healthcare equity by voting HB 5901 out of committee and onto the House floor. In conclusion, I'd like to thank Representative Shanley for introducing this wonderful bill, and thank you to the committee for your time and consideration.
Thank you for your testimony. Are there any questions for the witness? Seeing none, thank you. That concludes the verbal portion of the testimony. We have received over 30 written letters and emails in support of this bill. We've also received one written testimony against it from AHIP. And that concludes the testimony on House Bill 5901. Next, we will go to House Bill 5902 by Chairwoman Serpa. And this would, I'll let you explain the bill, Chairwoman.
Thank you, Chairman and members of the committee. I was asked to submit this bill on behalf of healthcare providers and healthcare insurance policy holders. In fact, that would be many of us. This would require the prompt payment for healthcare service providers and to individual healthcare policy holders for any claims that we submit. It would require prompt payment within 15 days, as long as our claim is accompanied by a substantially complete, by the paperwork being substantially complete. And by substantially complete, EOHHS would determine what is substantially complete. So either pay the claim or you have within 15 days, or deny the claim with a full explanation for the reason for the denial and any other information that the health insurance company would need in order to pay the claim. And if the claim is denied, and the denial is the error of the health insurance company, they have, again, 15 days to review their mistaken denial. They have 15 days to review that, and if they don't pay the claim within 15 days, the healthcare provider or the insurance policyholder begins to accrue 15% interest on the 16th day, if you can follow that. And I was asked to submit this, Chairman, I'll be honest with you, on behalf of healthcare service providers and healthcare insurance policyholders. I don't know if you have any other witnesses, but since I submitted the bill, no one has contacted me about it, so I don't know if you have anyone else.
Chairwoman, we don't have anybody verbally testifying on this bill. However, we have received written testimony in favor from Horizon Healthcare Partners, and we've received written testimony against from AHIP.
Okay. That's good to know.
Yeah.
Thank you. Representative Fenton-Fung.
Rep. Serpa, I so appreciate this bill on many levels, one as a healthcare practitioner, because some of these claims can go on 90, 120 days. I was trying to find throughout the bill, because there's so many great provisions you have in here, sometimes what'll happen is we'll submit, this happens a lot when we're treating children for torticollis. They get those special baby helmets, whatnot, you've seen them before. And we'll submit it, and then they'll want extra questions answered or whatnot. Sometimes that'll take 7 or 8 days to put together by the time the two practitioners catch in on each other. I'm just wondering, and I don't see it spelled out here, when there's a peer-to-peer, we call it in healthcare, or a doctor-to-doctor conversation, would the 15 days start from that point or from the original submission of a claim? Because that's just a fairness aspect, I think, that to the insurance company to get a little more, especially if we're late, especially if it's our...
Representative, I'd be lying to you to tell you I know I have the answer to that information. As I mentioned, I do not remember. I submitted this bill so long ago, and with the very odd setup that we're operating under this year, no one has contacted me since I submitted the bill, so I can't answer that question.
Okay, that would be my question.
But it's a fair question, absolutely.
Yeah, to be fair to everybody. And then, would this also carry over to nursing homes?
Yes, absolutely.
I can't tell you, considering how hurt they have been by the state's incompetence with UHIP, how absolutely wonderful that is.
I think we on oversight absolutely understand that.
Thank you so much.
Absolutely. Thank you, Representative.
Thank you for your testimony. And that concludes the testimony on House Bill 5902. Next, we will go to Chairwoman Serpa's Bill 5899.
Thank you, Chairman. This one I have a little bit more information on, and I submitted this on behalf of FedEx. And as you know, you probably know that Rhode Island being such a small state, companies often pilot very many programs here because we're such a small state, and geographically it's easy to get around. So FedEx has worked with a robot company. In fact, I'm told that it's the same company that built Congressman Langevin's wheelchair. It has the ability to climb the stairs, go down the stairs. Well, they have piloted a robot, and his or its name is Roxo, R-O-X-O. I haven't met Roxo, but the robots are designed to deliver packages from business to business or business to consumers, and they'll only deliver within a range of 3 to 5 miles. These robots reduce congestion and pollution, and they use a combination of sophisticated machine learning, artificial intelligence, and sensors to travel on sidewalks and in the shoulders of some highways. This would be a 1-year pilot. The personal delivery devices are called PDDs in robot language, I guess. And they have GPSs. They can navigate around obstacles, around curbs, around steep slopes. And they've already been piloted in New Hampshire, Tennessee, Texas, in a variety of environmental scenarios. And I think you're going to hear some testimony that they will take some jobs, but I think the other side of this technology is that's likely it's encouraging new jobs such as high-tech machine experts, software developers, and remote operators. And another example was pointed out to me. In fact, I spoke to my colleague in the Senate, Senator De Palma. You might know that he works for the defense industry, and he's very excited about this technology. And he was speaking a language, frankly, that was over my head. But he said, think of it as someone owning an auto parts store in Pawtucket, a very small businessman, an independent businessman who owns an auto parts store in Pawtucket. I'm having a car repaired in West Warwick, and my repairman doesn't have the part that he needs to complete my repair, but this auto parts store in Pawtucket has it. So I guess Roxo can be outfitted with this part that I need, and he can, or she, or if it's non-binary, I don't know what we call Roxo, but Roxo can be outfitted with this auto part, be sent to West Warwick, and my repairman could have it the next day. And I don't think it's meant to replace the packages that we're familiar getting from Amazon, FedEx, even the post office. It's not meant to replace those kind of delivery people, but it's a new generation of same day or next day delivery that I hope you'll at least consider. And I think there are people on the line, I hope there are, that know much more about Roxo and the other PDDs to deliver essential products. Oh, and by the way, they can take out food, groceries, and as I said, auto parts. So that's all I know about Roxo.
Very interesting as the technology changes.
Yeah.
Are there any questions for the sponsor?
On the road, yeah.
Seeing that there are no questions for the sponsor, thank you for your testimony. First, we will go to Robert Goldberg from FedEx, representing FedEx. Mr. Goldberg, you may proceed with your testimony.
Thank you, Mr. Chairman and members of the Corporation Committee. I'm on the phone tonight on behalf of FedEx Corporation, which is encouraging or suggested this bill to Representative Serpa, or Chairman Serpa, I should say, who is a very, very difficult act to follow. This is modern technology trying to accommodate the needs of the changing world, the world of COVID, although it wasn't designed specifically with COVID in mind, but it's a way to beat congestion. It's a clean vehicle. It does small deliveries. It's not meant to replace all the deliveries by any stretch, but it's a new innovative technique to try and get packages to people in a timely fashion, particularly business to business and in congested areas. Obviously, it's not designed for long distances, but it's intended to be very helpful. It's based on a wheelchair frame which was developed up in New Hampshire, and hopefully it will be good use to society. I know there are some people objecting, as Chairman Serpa indicated, this is going to cost delivery jobs. I would suggest to you this is going to replace, to some degree, some delivery jobs, but replace them with high-tech computer-type jobs and engineering and things of that nature, better jobs. But it's not meant to replace all the packages we see being delivered around the country. It doesn't do that. It does the smaller packages in confined quarters. Rhode Island has been selected as an area to try it out, see if it works, see if it's acceptable to people, and I certainly encourage the passage of this innovative technique. There are amendments coming. FedEx has been working with the Registry of Motor Vehicles to meet their concerns, and a Department of Registry and DOT as well, and trying to make everybody happy. But we sure hope that we get a chance to experiment with this project in Rhode Island. Thank you.
Thank you. Are there any other states doing this right now?
Yes, there are. Let's see. There are, I think, about 6 other jurisdictions. I'm just looking at my notes here that are trying. Oh, here we go. New Hampshire, Memphis, Tennessee, Plano, Texas, and Frisco, Texas are already underway with this. Part of the reason that Rhode Island looked like a good place to roll this out, no pun intended, is it was developed up in New Hampshire and nearby to the resources where it was developed. But yes, it's been successful to my knowledge, it's been successful everywhere that it's been tried.
Okay, thank you for your testimony. Representative Fenton Fung, you have a question?
Yeah, let's see. Page 3, line 9. It says at a speed not to exceed 20 miles per hour on the highway. How does that work so much, and where do these devices roll on a highway like that, going 20 miles an hour?
Well, no, they would not, Representative, you raise a good point. It's not intended to go down the highway at 20 miles an hour. That's the maximum speed. In some areas, it will be on the sidewalk far, far slower than that, more walking speed. But in areas where there are no sidewalks or ways to go from one location to the next, it would be on the curbside, out of the flow of traffic. 20 is the maximum speed, but I don't anticipate, or it's not anticipated, that would be the normal speed for the vehicle.
In Representative Fenton Fung, I think a highway could technically be construed as, I know the West Shore Road in Warwick is a state highway,
Highway. Okay.
which has a speed limit of 35 miles per hour or so. So I don't think they'll be driving down 95.
That's what I'm like, what are we doing here? So I appreciate that clarification. Thank you.
Thank you. Just going to look to legal counsel. Mr. Knowles, did you have a comment, question?
I was just going to say, to support what Mr. Goldberg was commenting on, DMV has submitted a letter saying that Pennsylvania has what he considers a model legislation as far as this aspect is concerned. So I assume that that state must also have these vehicles somewhere operating in that state. They wouldn't create a law if they weren't going to use them.
Okay.
Yeah, I can say that the company's been working with the state of Pennsylvania as we have been here, and I know they're going to be up and running in Pennsylvania very soon if they're not already.
Great, thank you. Are there any other questions for the witness? Seeing none, thank you for your testimony. Next, we will go to Paul McDonald from the Teamsters Local 251. Paul McDonald, you are here before the Corporations Committee. You may proceed with your testimony.
Well, good evening, Mr. Chairman, members of the committee. It's nice to see you all. It's like getting a legislative night out since we've been so homebound. But I'm happy to be here with you always. My position is the legislative director for Teamsters Local 251. I'd like to, on behalf of the 7,000 plus Rhode Island Teamster members, we strongly encourage and ask you to oppose House Bill 5899. These PPDs, as they're describing them, I would describe them also as slash vehicles. And I'd like to, if I can, address several issues, amongst the main issue that this is another job-killing bill for UPS workers, and I would include some of those FedEx people who get hurt by this too. But UPS workers, remember, who quite frankly stepped up during this pandemic to keep Rhode Island moving, who provided Rhode Islanders with the groceries, the medicines, and other essential goods we all need. The well-being of our communities get hurt if these devices slash vehicles replace the good-paying, blue-collar jobs of your constituents, your neighbors, who contribute and pay taxes into the local and state cities and towns. They pay taxes. These little vehicles ain't going to pay no taxes. The safety issues of this legislation are enough to reject these devices on its own without talking about the good paying jobs that we all have talked about over the years, not trying to eliminate them. My God. They are immense safety, liability, and community well-being issues raised by this legislation. Among, as we see it, the major safety issues, if you will, there is no weight limit to these devices. Never mind the weight of the cargo they may haul. Tie that into the 12-mile-per-hour speed limit on sidewalks, and by the way, Representative Fenton Fung was right spot on. 20 miles per hour speed on roads. Remember, if you haven't seen these are large, low-lying, though, vehicles. And they are not going to be seen well by people who are driving automobiles down their roads. That's for sure. This machinery can weigh up to 0.5 ton. It's a recipe for disasters. It's not good legislation at all. Think about them moving on the sidewalks at 5 times the average person's walking pace of 3 miles an hour. Quite frankly, in my case, I'm probably down to 1 or 2 miles an hour, and I don't think I want to meet one of them walking out of my driveway or out of my house. This is danger. The drivers will have a terrible time seeing them. They're small and low, as I spoke to. Add this with the fact that the minimum liability coverage, which should get everybody's attention, of these devices is an arbitrary $100,000 per incident. That alone should disqualify this bill from consideration. The risk for damage to people and property is unknown. Serious thought and careful consideration should be given to evidence-based liability dollar amounts, I would think. And I heard my good friend talk about all the places that they have been approved or whatever. But quite frankly, I would have bet that most of them are on college campuses delivering pizzas, not delivering auto parts across the state, which I don't even know how that's going to work if it came from Pawtucket to Warwick. I mean, I don't know how those little things are going to travel through Providence. They'll probably end up in the Providence River before they get to their destination, knowing what goes on down there. Package delivery is, quite frankly, is an important middle-class profession that provides stable jobs to hundreds of Rhode Island Teamsters and many more other delivery people who have no voice. And finally, this bill ties the hands of local elected officials by mandating that they meet and consult with private companies if they wish to restrict or ban the devices in their cities and towns. Jesus. I don't get it. These devices are not a one-size-fit-all, I guess, solution for our communities. Local leaders should be able to make decisions that impact their citizens without being forced by state government to consult with for-profit business entities.
Thank you, Paul. I believe Representative Fenton Fung, do you have a question?
Paul, I'm with you on this, and I've seen you walk faster into Twin Oaks than that before, too, so I know you can still move. And we love you for it, Paul. I agree with you. We're just kind of sidebarring around here, and I'd love to see a video of these things and to kind of put the abstract and to see what this is. We're talking about if they're rolling on the side, are they taking out bike lanes? Are they taking out people? I think we visually need to see how these things are operating in different states, and maybe we can get our hands around it. But like you said, if you're going from Pawtucket to Warwick and you're not on a highway, that's probably a 4-hour journey.
I'd recommend watching Terminator 2.
It it's wild. And I don't want to boohoo technology. I'm not that person. And I know that things will advance. And I hope this Teamsters help, as things advance, help to train their members to take these jobs as well. I'm struggling with this entire bill because I just don't think we can visually see this, and we're getting a little on the ridiculous side. So I appreciate it.
Great. Thank you for your testimony, Paul. Are there any other questions for the witness? Hearing none. Thank you for your testimony. Last up, we have Randall Rose. Randall, you may proceed with your testimony.
Thank you. I'm concerned about this bill and would like to speak against it. The bill is actually preemptively legalizing this technology and forbidding cities and towns to do a lot to regulate it when we don't know a lot about the problems with this technology. I know a number of people have expressed concerns about how we don't know a lot of the problems of this technology yet, and I don't think we should be rushing to stop cities and towns from regulating this, from restricting hours of operation, when we don't know the problems with it. These personal delivery devices, as they're called, are not really personal. They are likely to cause a number of problems. For example, if one of them goes into the courtyard of an apartment building, is that going to cause conflicts with people? What happens when one of these delivery devices is sent to somebody's house or someone's apartment building when they're not expecting it? There's no regulation about what can happen with the video that's captured by this device, how that video can be used. Will it invade people's privacy? The speed limits mentioned in this bill are too high, and it is also going to carry the risk of losing jobs, because it's going to put human delivery people out of work. Now, of course, some of these problems could be solved, perhaps, but I don't think we should be rushing to preempt cities and towns from passing regulations and, if necessarily, restricting the use of these devices until we have more of an idea of how they work in practice and whether these problems will be solved. It's kind of like the Marty devices in the supermarkets, which are actually operated from a control center in the Philippines. They're called robots, but they're not really robots because there's a control center in the Philippines. So they are used. Those Marty robots are used to. Their primary use is to acquire information about people in the supermarket. And this bill does not consider the video acquiring and privacy implications of this at all. So for these reasons, I oppose the bill, and I think it needs some more experience before we try to pass something this sweeping.
Thank you. Are there any questions for the witness? Hearing none. Thank you for your testimony. Next, I'm going to hand it over to Vice Chair Caldwell.
Thank you, Chairman. We'll now start the hearing on Representative McEntee's bill, House Bill 5768. It's an act related to business and professions and roofing contractors. Chairwoman, do you want to go ahead?
Thank you, Madam Vice Chair. This act would amend the regulations and licensure requirements of roofing contractors by modifying the requirement of 10 hours of continuing education per year to 12 hours of continuing education every 2 years. The act further increases the requirement of an insurance certificate from $1,500,000 to the amount of $2 million. This bill was brought to me by my constituent, Tom Fury, who runs a roofing company. And basically, this bill would streamline the registration and licensure requirements of roofing contractors to align with the standards in neighboring states. It will relieve regulatory burdens and help similar businesses to comply with regulatory framework. It is substantially similar to the provisions that were included in Governor Raimondo's budget proposals related to government reform and were supported by the Department of Business Regulation. Under the proposal, education requirements would be streamlined to be 12 hours over 2-year licensing period rather than the 10 hours over 1 year. And that, again, is in accordance with other neighboring states. And it would eliminate a bonding requirement. This is one of the important things about it. It eliminates a bonding requirement that is regionally unique to Rhode Island. So this will help businesses and it'll also protect consumers. I think my constituent Tom Fury is waiting to speak, as well as Billy Walsh. So if anybody has any questions, I thank you, members of the committee and the vice chair, for hearing me. I'm ready to take questions if you have any, but I think they probably would know the answers better than me.
Thank you, Chairwoman. Does anyone have any questions for Chairwoman McEntee? Okay, we do have 2 people signed up to testify on the phone. The first is Bill Walsh, from the Builders Association. Is he on the phone? Hi, Bill.
Thank you very much, Representative Caldwell, members of the committee. Bill Walsh here on behalf of the Rhode Island Builders Association, here in strong support of legislation just offered by Representative McEntee. She did a wonderful job laying out the framework for it. And so we're here to express our support. The industry believes that we're kind of have some outlier structures here that we're trying to clean up. We're happy that we've had the support of the department in the past. Hopefully, I'm not sure if they're signed up tonight, but we hope that they're still with us. And this really just helps level the playing field for our contractors, relieving regulatory burden, and allowing us to really get down to work. And I know there are other members here, and you have a long agenda, so I'll close there, and I'm happy to answer any questions about the bill.
Thank you, Bill. Does anyone have any questions for Bill? Seeing none, we can move on to Tom Fury. Hi, Tom.
Yes.
Hi, you're in front of the House Committee on Corporations. You can proceed with your testimony.
Good evening, members of the committee, Representative McEntee. My name is Tom Fury. As Representative McEntee stated, I am the owner of Fury Roofing Company in Warwick. I am also the chairman of the Contractors Registration and Licensing Board, so I'm well familiar with this legislation. I'm here to speak in support of it. I think the legislation is self-explanatory, as Representative McEntee laid out. I don't have a statement, but I am here to answer questions.
Thank you. Does anybody have any questions for Tom? Seeing none, we also had written testimony in support from the Associated Builders and Contractors of Rhode Island, and then that will conclude the hearing on House Bill 768.
All right. So next bill we will go to is House Bill 5903 by Chairwoman Carson.
Thank you.
Chairwoman Carson, would you like to describe your bill?
Yes, my video looks like I'm floating in clouds, but actually I'm just sitting in a chair. So thank you for hearing this bill this evening, ladies and gentlemen. This bill actually was put in by request, and I did not indicate that on the legislation. But a constituent of mine, who I believe is going to testify, came to me a while ago and asked me to consider putting in this bill, which would create a wellness insurance program for pets. And if you look at page 2 of the bill, it would create wellness coverage very similar to the types of coverage that we have as men and women. It would create a policy or a product within policies that are for spaying, for vaccination, for testing. Those are, at this point in time in the state of Rhode Island, they are out-of-pocket expenses for pet owners. And I know that we use them. You know, we go and we get our annual checkups and we get different tests done, and that is preventative in the long term. So this is really a way to create a preventative medicine type of a policy for pet owners in the state of Rhode Island. So it's really very simple, and I would like you to consider this bill.
Thank you for your testimony. Are there any questions for the sponsor, Representative Fen Fung?
Thank you, Rep. Carson. I know your passion for animals and whatnot. One concern for me under wellness coverage on page 2 includes cremation. It just seems to be a difficult thing to do underneath a wellness section. I didn't know if that was...
I hear you. The language from this bill came from other states and other programs around the country. We consulted with a few insurance carriers. So that seems to be pretty standard, I think.
Interesting.
So that's why it's in there.
Okay, thank you.
You're welcome.
Are there any other questions for the witness? Hearing none, thank you. We have Kristen Cassidy. Kristen, you're before the House Committee on Corporations. You may proceed with your testimony.
Thank you. Good evening. My name is Kristen Cassidy, and I am the constituent that raised the issue of pet wellness care with Representative Carson. By way of background, my husband and I have a 5-year-old English Lab, Truffle, and we have had pet insurance with one of the premier pet insurance carriers in the country for 5 years. Our insurance provides, first of all, and number one, insurance coverage for accidents, illnesses, injuries, etc. And we also elected to add on to our insurance coverage a separate optional insurance product called a routine wellness rewards plan, which allows us to set aside our own money every month, similar to a health savings account for people that is available during the policy year for the routine care that our insurance does not cover, such as the annual appointment, vaccines, spaying or neutering, flea and tick medication, etc. And the carrier gives us a $25 reward as incentive that adds to the balance. And we've taken advantage of the Wellness Awards Plan every year for 5 years for Truffle's routine care. Unfortunately, I had quite a surprise after taking Truffle to her annual appointment in Newport, Rhode Island last December. The bill was almost $700, and our veterinarian office kindly sent the invoice to our carrier as usual so that we would be reimbursed from our wellness plan. We were informed later that the wellness plan was no longer available in Rhode Island. So I called our carrier and learned that Rhode Island had taken actions that made it impossible to offer this option as an insurance product any longer. I also learned that no other state in the country has taken such an action, only Rhode Island. It's my understanding that there's a fundamental misunderstanding going on between what is insurance coverage, quote unquote, for which a premium is collected by an insurance company, and a deductible may apply, etc., versus what is an insurance product. The Wellness Care Awards program that I mentioned is a separate insurance product that's offered to policyholders. It's a budgeting tool that rewards pet owners for being proactive with their pet care. It's the policyholder's money. And as I said before, well, backing up, all of the insurance companies pay a state tax based on their premiums for insurance coverage. And as I said before, I believe there's a misunderstanding on the part of Rhode Island as to what is insurance coverage versus an insurance product. And I think that Rhode Island somehow must believe, or would like to believe, that my wellness account, which is optional, an insurance product, is somehow actually insurance for which they can try and collect a premium tax from my insurance carrier. And they are wrong. The wellness plan is the policyholder's money that's just set aside during the year. I'm very troubled by Rhode Island's actions, not just because it appears wrong on its face, but also because it will have a direct impact on many pet owners' ability to provide expensive preventative care for their furry family members.
Thank you.
Excuse me?
Oh, thank you. Do you want to conclude?
Yeah, just in closing, I think it's especially serious because the COVID crisis has led to a huge increase in pet adoptions, and homeless shelters are empty, and they have the good fortune to have homes now. And all of these pet owners need to have the ability to pay for preventative care in any way, shape, or form possible. And any carrier that wishes to afford policyholders with such an insurance product should be applauded, and Rhode Island should not get in the way.
Thank you. Thank you for your testimony. Are there any questions for the witness? Seeing none, thank you for your testimony. And that concludes the hearing on House Bill 5903. Next, we will go to House Bill 5777 by Representative Giraldo. Representative. This act would establish the Business Notification Act, which requires businesses to be notified by mail of any material change made by the state or regulatory agency. Representative Giraldo.
Thank you, Mr. Chairman and members of the committee. Yes, this act would also be connected to, would not be limited to any changes pertaining to licensure. Actually, let me just backtrack. Sorry. This act would establish the Business Notification Act, which requires businesses to be notified by mail of any material change made by the state or regulatory agency, including but not limited to any changes pertaining to licensure requirements, health and safety, hours of operation, or any other conditions which said business is subject to by the state. The act would also allow businesses to receive notification of a new regulation by means other than mail, including email, text message, and phone call, should they opt in. As you know, Central Falls was devastated by the pandemic this past year, due to numerous reasons, including lack of access to testing early on in the pandemic, as well as our residents being, most of them being frontline workers that worked through the pandemic, our density, our multi-generational homes, etc. We were hit hard. We were even featured on in the Boston Globe and the New York Times for both the overwhelming prevalence of the disease, but also for the valiant vaccination efforts of the state and of the volunteers that are still working every day. But in the summer of 2020, while the pandemic was raging in the streets of Central Falls, I worked as the chief of staff to the mayor in the city. At that time, the mayor was concerned about the numerous regulations being passed by the state and was worried that they hadn't been making it down to our little guys, to our mom and pop shops, our small scale restaurants, or to our convenience stores. Many of them, if not all of them, owned by minorities. So we decided to invite DBR down and have them walk the streets with us to do an unofficial compliance check. We wanted to see if businesses were complying with the several executive orders and regulation changes that had been passed. Mind you, that as of today, we're up to our 127th COVID-related executive order. Before regulators went out and started enforcing. The last thing we wanted was for our hardworking businesses on Broad and Dexter Street, which are the lifeblood of our city, to be impacted by regulation that they just simply weren't aware of. So we split up into pairs and split up different sections of the city. Thankfully, our city is nice and small, so it's somewhat manageable. I, along with my DBR buddy, visited maybe 15 businesses to check in and see how their reopening was going. Did they have their reopening plan posted on the wall? Did they have the proper signage that was required? Did they have their social distancing floor markers that were required for some businesses, etc.? Out of the 15 that we visited, none of them had that plan. But they all did have handwritten signs in English or in Spanish about making sure that you're wearing your mask and keeping the 6 feet of distance. They all had hand sanitizers, though the 6 feet of separation regulation wasn't listed anywhere. It was the employees that were making sure that that was happening. They had all heard these things from their traditional sources of media. Univision, Telemundo, Portuguese radio stations. That's how they get their news. Not by listening to the governor on the TV or the traditional other sources that many of us receive our news from. You see, my small mom and pop shops in Central Falls may speak English, but they get their news from those non-traditional sources. They work throughout the day as they cook in their restaurants, They serve as the service person at the desk of their shipping company, or they're the barber in the barber shop. Honestly, they didn't have time to watch the press conferences because they were working. And many of them are just not tech savvy. And just to be clear, I think we all know you don't need to be tech savvy to open or run a very successful business. We actually have several thriving in the city of Central Falls and across the state that are run by hardworking, earnest people. All the businesses that we visited that day wanted to be in full compliance. They were willing to fill out the plan right there on the spot and post it to their walls, as they were required to do so. They would be happy to put up the bilingual signage that they were supposed to access by going to a computer with the internet, going to the Reopening RI website and printing out copies and bringing it to the business. They just didn't have that. Every single one of them, as I mentioned, wanted to comply, but were never contacted about these critical changes that would have cost them an arm and a leg if a regulator had come by and done a compliance check. Therefore, I believe we should be putting it, Therefore, I don't believe we should be putting it on our small businesses to continuously monitor the Reopening RI website or the various departments' websites, scouring them for regulation changes that could impact them. I think we should do what's right and send them the notice that affects their business. I envision that several of the requirements they have to complete as a small business are still done by mail. So why is it that we can't mail them a notice when something that could close them is implemented? I spoke with the DOA today on working together, and I also see that they provided a written testimony against this bill, but have yet to propose a solution. I also know that DOA talks about their opt-in services that requires businesses to go to them and sign up, but I think it should be reversed. I think the program should be an opt-out program, and you can opt out to receive, instead of receiving printed mail, you can receive text messages, email, phone call, etc. So I ask you to consider your small mom and pop shops, your small businesses that may not be tech savvy, those that may speak another language other than English, and those that just like good old-fashioned pen and paper to do their business, and I urge the passing of this bill. Thank you.
Thank you for your testimony. Whip Chippendale.
Thank you, Chairman. And thank you, Rep. Geraldo, for introducing this legislation. There's one thing we certainly do very well in this building, and that's make laws and regulations. And there's something else we don't do well, and that's let people know about those laws and regulations. I think you articulated very well, particularly in the context of the added burden of the pandemic, the impact it's had on just your small community. No business, no entity is immune from those same struggles, you know. The simplest of changes that we may make in a 6-hour-long budget debate here may not trickle down to those folks. I think what you're proposing here is not only reasonable, but I think it's way overdue. I think it will certainly save business owners a whole heck of a lot of headache, money, time, aggravation, and frankly confusion in trying to figure out what the heck they need to comply with, because in the majority of cases the business owners simply do want to comply so that they can get on with running their business. So again, I applaud you for this. I hope that we get some great traction from this initiative and that we're able to put it into effect, because this is about close to a magic bullet on this regulatory issue and the information disseminating out into the community as we could get. So thank you again for putting it in.
Thank you.
Thank you, Chairman.
So, Representative, I do concur with Whip Chippendale's comments on this. I have read the Office of Management and Budget's comments on written testimony against this bill. Although they do raise some valid points, I don't think they're insurmountable. I definitely think that there's some type of language or some concessions that could be put together to get to where it needs to, so that small businesses that are required to implement these, new laws and regulations should at least be notified somehow, some way. Representative Fenton.
Thanks, Rep. Geraldo. I think I concur with my two colleagues here on how much this is needed. One of the things, though, when you're a small business, there's so many local ordinances that are going to probably impact them more than even some of the state legislation, which is not to diminish the fact that we need to communicate better at the state level. I'm wondering if when you're working to kind of make this bill better, if it's like even possible when they do their filings every year and whatnot, their annual report, I do think you should opt in. I'm a big, like, while you're doing your paperwork, that they go in and that way they kind of identify how they want to be addressed, whether, like you said, via text message or email or mail. I think, we could do that once and then try to get everyone involved. But I would also try to reach out to some of the major cities and towns and see if they can kind of start doing this as an initiative, and how they can coordinate better, because some of the things that are really going to impact them on the day-to-day level are those local ordinances. And I would hate for them to say, oh, well, nobody told me, the state's doing it, you didn't tell, you know what I mean, and just kind of get a little ahead of ourselves. So I think if we could do it all together, it's a wonderful initiative.
Yeah, thank you for that. And from my experience in the city of Central Falls, our small team there was always on the ground, making sure that our small businesses were aware of any local ordinances, any local changes, by mail or in person. A lot of times it was in person. Thankfully, we were small enough to be able to do that. But it was when there was massive changes coming out that added on to the burden that we were already fighting. We were fighting the pandemic, and so the burden of all these changes and having to try to communicate those while we're already trying to communicate that all of our parks are now closed and all of these other things are happening. It was overwhelming, and so if there's a way for businesses to receive that mail, and if they don't prefer the mail, then they opt into receiving those other services. Notification other ways, I'm completely open to that, and that's what I tried to address in my bill.
Yeah, and I think too, not every city has the luxury of being as small as Central Falls is, for sure. I look at the city of Cranston, how that would be a little bit more difficult on scale for a municipal community. But I do think you're on the right track. I'd love to see what some of the major municipalities, whether it's Cranston, Warwick, Providence too, how they could do it logistically. Yep. And I'd love to see it. I know you mentioned English and Spanish, but outside of it, I'd love to see some of the Southeast Asian languages as well. I think the language barrier is one of the hardest, one of the biggest barriers right now to compliance. They just don't know, especially that way. So I think you're on the right track, and I appreciate your efforts.
Thank you for your testimony. Are there any other questions for the sponsor? Seeing none, we have received written testimony in favor from the Rhode Island Business Coalition, written in favor from Mega Armstrong, and then we've received a written testimony opposed from the Rhode Island Department of Administration, OMB. And that concludes the testimony on House Bill 5777. Next, we will go to House Bill 5775 by Representative Giraldo.
All right. Thank you again, Mr. Chairman and members of the committee. This act would require that all parking lots designated for motor vehicle parking spaces, specifically designed for people transporting young children under the age of 3 and baby strollers, with the exception of parking lots for single-family, duplex, townhouse, or multifamily residences. Some of you may know that I'm the proud father of 2 beautiful, powerful, strong-willed little ladies, ages 2 and 5 months. And the sponsor on the Senate side, Senator Acosta, is also a new father, and it's our honor to present this bill. There aren't many things in life that are as hard as raising 2 little ones. They can absolutely be a handful. My infant loves crying, squirming around, and soiling her diaper at the most difficult times, and my 2-year-old loves crying, yelling, and running around, especially to jump in puddles, regardless of puddle size. And I'm sure that many of you know exactly what I mean. And while my 2-year-old running around to jump in a puddle is probably the cutest thing you'll ever see, it obviously can be dangerous in a large parking lot. And a trip to the supermarket can be a large undertaking when you have 1 or 2 or multiple little ones with you. It's not as easy as getting out of the car, locking the doors, and leaving. There's a whole procedure requiring taking the stroller out of the trunk, unbuckling the baby from the car seat, putting them safely into the stroller while making sure you don't leave anything behind, like their diaper bag, with the bottles, diapers, all the essential gear, while also ensuring that the stroller is locked and not rolling away in the parking lot. This doesn't include, and that doesn't even include when there's more children involved for the ride. So what this bill looks to do is simple. Have large parking lots, only those with more than 100 parking spaces, implement a family-friendly space next to, but never replacing, a handicapped space. I believe that having this space will make parking lots safer for families with little ones. It's not really a heavy lift. Signs can be purchased online for $20 to $25, and I have faith and want to assume the best in Rhode Islanders, that they understand the importance of being a family-friendly state and would comply with the signage. These signs are up in other countries like Great Britain and in counties across the country, Miami-Dade, for example. And so with that said, I don't really feel the need to create an onerous or expansive permitting process like some places that I've researched have, or threaten Rhode Islanders with heavy fees for parking in those spaces. I just think we should put our best foot forward, put up some signage in our largest parking lots to ensure the safety of our families and our little ones. And I thank the chairman and the committee for hearing me out today.
Thank you for your testimony. Are there any questions for the sponsor? Representative Shalcross Smith.
Thanks. No, they'd be the same size. Yeah, same size. Yep. Yeah, standard size. Yep.
Are there any other questions for the witness? Hearing none, that concludes the testimony on that bill. Next, we will go to House Bill 5776 by Representative Giraldo.
All right. Thank you, Mr. Chairman and members of the committee. This act would prohibit financial institutions from investing in private detention centers or continuing to invest with any institution, company, or subsidiary of a company that owns or contracts with a government entity to manage or run a prison. Last night, I testified in state government, in the House Committee on State Government, about the harmful impact that private prisons and the Rhode Island General Assembly creation of quasi-municipal detention corporations can have in our state. And it seemed welcomed by the committee. And I introduced those bills that are correlated with this, so I'm just going to explain those bills very quickly. 5749 would repeal the Municipal Detention Facility Corporations law that was passed by the General Assembly back in the 90s and prohibit the operation of private detention facilities and private-public partnerships regarding prisons within the state. 5750 would prohibit contracts with private for-profit prison facilities or with the U.S. Immigration and Customs Enforcement. And H5751 would provide for a safety inspection of the Wyatt Detention Center, a quasi-municipal detention corporation, or also known as a private prison, twice a year unannounced. And this bill is along those same lines. Simply put, private prisons, private detention centers, and quasi-municipal government entities are a line of business that Rhode Island and the Rhode Island legislature, as well as our financial institutions, should never have gotten into, and it puts profit in front of people. Justice should not be a money-making endeavor, in my opinion. We would all be horrified if judges suddenly were paid on commission based on the number of people they convicted. And so why is it okay that we have a prison system that benefits from the higher number of incarcerations? I think we would all agree that justice should never be dispensed with one eye looking at a profit margin, ever. Work to dismantle the private prison system began under President Obama, and in January of this year, as part of his first set of actions as our new president, President Joe Biden, signed an executive order that will phase out the Department of Justice's use of private prisons. President Biden stated that this is the first step to stop corporations from profiting off of incarceration that is less humane and less safe. He called it the beginning of his overall plan to address the systematic problems in the criminal justice system. And several high-profile financial institutions and pension funds have sold off their share in the large private prison entities. These banks are growing and are increasing every day. JP Morgan Chase, Wells Fargo, Bank of America, BNP, SunTrust, and Barclays. While Fifth Third Bank and PNC have additionally made commitments to stop providing financing to the private prison industry as a whole, and that number is growing every day. These recent divestments come in the wake of demands by legislators like us and grassroots activists, many under the banner of the Families Belong Together coalition, and from pressure put on by shareholders, policymakers, and investors. Major banks supporting the private prisons behind mass incarceration and immigrant detention have now committed to not renew an estimated $2.4 billion in credit lines and term loans to the industry. But we as a state have work to do ourselves to ensure that we aren't playing a role in a system that only profits when their cells are full, or one that is willing to cut corners and maximize profits with complete disregard for the health and safety of both the prison employees and the incarcerated individuals. We need not only look to the Wyatt Detention Center, our own local example of a private prison / quasi-municipal detention corporation. Here's some quick notes on the Wyatt. 400 inmates and staff have contracted COVID-19 out of the 500 or so inmates that they have at the moment. In 2008, there was the death of a Chinese national that had overstayed his visa. He had been complaining about spinal injuries and what turned out to be cancer, a cancer that went untreated and intentionally ignored, which ended up costing him his life. You may also remember that in 2017, the entire city of Central Falls, it was on New Year's Day, so maybe it might have got lost in the news, but the entire city of Central Falls was on lockdown after a dangerous felon escaped due to poor staffing levels. He escaped by climbing up a basketball hoop and escaping out some hatch in the ceiling and jumped over the fences, almost like some kind of bad action movie. But I'd like to repeat that my whole city, 1 square mile, was on lockdown because of this. He could have been in anyone's backyard. Do you know what it's like to have to shelter your kids in your small apartment because you just heard a fugitive escaped and is less than a mile from your home, probably right down the street? Especially because the prison was unprepared and negligent, because my residents do. And how could this have happened? WPRI reported at the time that correctional officers at the private prison were working up to 80 hours a week. And why is that? Of course, they were working bare shifts to try to save money. Some of you may also know that the Wyatt has guards that were involved in a recent incident that was widely publicized, which showed an incident that showed complete disregard for human life, where one of the guards ran over protesters and pepper sprayed a crowd in the middle of the street without warning in an area outside of their jurisdiction. Somehow, no charges were brought forth. And if you're not familiar with that incident, I implore you to Google it and take a look at what I'm referring to. It was absolutely disgusting. And I won't even get into how the private prison system was set up to be an economic engine and bring about $500,000 a year to a struggling city. That was the promise. And it has gone 11 of the past 12 years without paying a single penny to the city. That means in 2010, the city of Central Falls received $0. 2011, $0. 2012, $0. 2013, $0. 2014, $0. 2015, there was a small payment of $200,000 out of the $500 because the city of Central Falls took them to court and worked out a forbearance agreement, which they then defaulted on every year after that. So 2016, 0, 2017, 0, 2018, 0, 2019, 0, 2020, 0, 2021. There had been talks of a small check of $50,000 coming to help pay for the services that they use that impact the city. But this bill takes steps to ensure that Rhode Island's financial institutions do not support this kind of broken system. You may recall that last year, Rhode Island joined several other states in pulling our $8.7 billion in pension funds away from any and all connections to private prisons, and now is the time to take that next step. We will not be alone, as many other states and the feds are all finding ways to sever ties with private prisons. And so, therefore, Mr. Chairman and members of the House Committee on Corporations, please join me in helping to dismantle these systems of greed and in stating that our prison systems need to be focused on justice, rehabilitation, and reform, not on making a profit off of people's misery.
Thank you.
Thank you.
Thank you for your testimony. Are there any questions for the sponsor? Vice Chair Caldwell.
Thank you, Rep. Giraldo. I just want to say thank you for sharing all of that with us. I agree with you completely. I hope that we can move this bill forward out of this committee, and thank you for bringing the concerns of your community that should be the concerns of all of us here so we could all hear them tonight.
Thank you.
Thank you. Are there any other questions? Hearing none, thank you. Rep. Morales, you're testifying on this bill, is that correct?
Correct.
You may proceed with your testimony.
Thank you, Mr. Chairman and members of the committee. Thank you again for the opportunity to discuss and consider House Bill 5766. I will be brief. As discussed by Representative Giraldo, this bill would essentially prohibit financial institutions within our state from investing in private detention centers or private prisons. First and foremost, no entity should ever be profiting from the incarceration of a fellow human being, which is exactly what these private entities do. After all, when profit margins and private corporations become involved within our criminal justice system, the purpose and incentive to rehabilitate incarcerated individuals is no longer the priority. As a result, this forces incarcerated people to suffer even worse living conditions, more mental health issues, and a lack of rehabilitation, which can lead to even longer prison sentences, recidivism, or even death. To illustrate just how inhumane private prisons and detention facilities are, a recent report from the U.S. Department of Justice found that private prisons had a 28% higher rate of inmate-on-inmate assaults, more than twice as many inmate-on-staff assaults, and twice as many confiscated illicit weapons when compared to public prisons. I want to be clear, there is a reason why private prisons and detention facilities produce some of these dangerous outcomes, and that is because the operators of these private entities are so focused on profit margins that they will take drastic measures to keep costs down. Thus, it is common practice for private prisons and detention facilities to hire less employees, provide less training, and provide less compensation when compared to a public prison. Most importantly, there is a concerning lack of accountability and oversight of both private prisons and private detention facilities. After all, they do not need to legally follow the same standards of transparency as a government-run prison, which is why they are allowed to get away with some of the dangerous conditions I've outlined. In other words, these private facilities are not subject to the Public Records Act, and they are not required to maintain records related to incident reports, staffing information, and facility conditions. Because the victims of this treatment are incarcerated, however, there is little desire from governments to actually address this issue. Now, this is why this bill is so important, because no financial institution in our state should be profiting from this abusive behavior, even if it is not necessarily happening in our backyard. But as Representative Giraldo pointed out, in some cases it is, as we have the Wyatt Detention Center in the city of Central Falls. Now, given that private prisons and detention centers have rapidly expanded over the last 4 decades, this is our opportunity as a state to push back against this and work towards a statewide divestment of these private entities. Thank you.
Thank you for your testimony. Are there any questions for Representative Phillips?
Thank you, Mr. Chairman. And I should have asked this for Representative Giraldo too, but either one can answer this. No financial institution shall provide financing for or invest in the stock securities or obligations of this institution. How can we enforce it, because we have some of the major banks in the area that's regulated by the federal government, not the state government? We can stop the local banks, the Bank Rhode Islands, the Navigant Credit Unions, those type, but you can't stop Bank of America, Santander, or even Citizens Bank, which is based out of Rhode Island, because they're federally licensed.
Yes, sir. This bill aims at taking as much, taking every opportunity that we can to stop any financial institution that we have control over from investing in those private prisons. So yes, it may not be able to influence other things outside of our control, but we are going to push for what we do have control over.
Thank you. Are there any other questions for the witness? Representative Potter?
Thank you, Mr. Chairman. Not a question, just wanted to echo Vice Chair Caldwell's comments about the bill. Very much appreciate both of you for testifying about it. And I think you've gotten at the root cause of a lot of the issues that we're really talking about, especially in light of the awareness that so many more people have right now about racial justice. and how so much of that is tied to a for-profit criminal justice system. So thank you both for being here to testify. Thank you for bringing the bill forward. And it's my sentiment as well that I hope that this committee will act on this bill and pass it through at some point.
Thank you very much.
Thank you, and that concludes the hearing on that bill. Next, we will go to Representative Phillips' bill, House Bill 5769, unfair sales practices.
Thank you, Chairman. House Bill 5769, actually, this has been in the works for years. This is the first year I've submitted it, but it's the first time I've really sat down and, after getting so many complaints from different constituents, not only of mine, but other people throughout the city, the state, and that, there's an issue with health clubs, it could even pertain to Verizon, Sirius XM, the gaming companies and that. They take the money, they automatically deduct their payment either from checking account, credit card, debit card, or whichever. And after a customer has asked them to stop taking the money out by whatever legal way that the company asked them to do, either verbally or in written or email, whichever it is, they continue to take it out for 2, 3, 4, 5 months afterwards. And so many people have gotten into some financial trouble because they've overdrafted their accounts, they've incurred bank fees, etc. So I finally got to the point after listening to them, I said, well, what can we do? So I came up with something like this. I've already talked to the AG's office. They like the bill. They have a few suggestions that they're going to come up with and send some testimony in to say this could improve the bill and that. I do see that we had 2 written testimony on the paper here, on the computer here. And the first thing I noticed, they use 2 different names, but it's the same company. So there's only one person that's against it, and that's because they think that, they're above the law or something with this. This is just a complete consumer protection bill. And the second half is if there's a large difference in either an increase or of their service contract, if they're reducing the service contract, or reducing, let's say it's Verizon or Cox or any type of TV, and they reduce the number of channels that's a substantial difference in what they're getting if they're paying the same. So they're actually increasing the price without letting people know. So I wanted to make sure that they are notifying the consumer 60 days in advance of any substantial increase in either cost or reduction or increase in services there. And with that, I'll try to take questions as much as I can.
Thank you. Questions for the sponsor, Whip Kazarian.
Not necessarily a question, but I have heard about this problem for many years, and I actually had a friend do it. Jim would not let them out of their contract. They finally had to cancel their debit card to get a new one to get out of these payments. So, great bill, and certainly a big problem.
It is a huge problem. Thank you.
Yeah.
Are there any? Vice Chair O'Brien.
I just wanted to agree because the same thing happened to me. I had to cancel my credit card to stop them from taking it out and get a new credit card. Because it's great. It's absolutely insane. They just keep doing it no matter what you do. And it's like $29.99 a month, and they just keep it because who's going to sue over $29? But they get away with it for 3 months.
2, 3, I've had people up to 6, 7, 8 months have money taken out, and that's at $30. As you said, at $30 per month, Representative, there's $180, $200 right there they could spend on groceries or whatever else they need.
All right. Are there any other questions? Hearing none. Thank you. We'll go first to Randall Rose. Randall, you may proceed with your testimony.
Thank you, and I wanted to thank Representative Phillips for introducing this great bill. So this is a real problem, and we definitely need consumer protections on this. And If there are concerns about the specific case of cell phone contracts where you have to sign up for a 12-month or 24-month contract in return for getting a cheap or free or discounted phone, there could be an exception in the bill specifically for those kinds of cell phone deals. But it definitely should be possible for consumers to cancel service that they no longer want if they've already paid for the full benefits of the period that service they've already gotten, and just want to cancel future service in return for not paying in future. Then that should be possible to do within 30 days. In fact, I would have preferred requiring companies to terminate service within a few days rather than 30 days, because I mean, in this day and age, it's very easy for companies to do that. So I think that's good. There could be some flexibility about the particular ways of requesting that they stop these recurring charges. If there's the company wants to say that they only accept notification by email or by phone, there might be some flexibility in that. But on the whole, the idea behind this bill is very good, and these are really abusive charges. I can't believe the companies are allowed to get away with this. So thank you for introducing the bill.
Thank you for your testimony. Are there any questions for Randall Rose? Seeing none, thank you for your testimony. We have received written testimony in opposition from the Internet Coalition, which appears to be comprised by TechNet, Internet Association, NetChoice, and the State Privacy and Security Coalition. And that concludes the hearing on House Bill 5769. Next, we will go to House Bill 5512 by Whip Kazarian regarding proof of financial responsibility for the future. Whip Kazarian.
Thank you, Chairman. I put this bill in by request of a constituent. You should have all received her written testimony. She wasn't able to come and speak in front of the committee, but she did want to submit something. This bill would raise the minimum amount of auto insurance coverage that Rhode Islanders would be mandated to have. She came up with this bill idea and she asked me to sponsor it because she was hit by a driver. Luckily, she was very well insured, and her coverage would cover the low insurance that the other driver had, and take care of her car. But it got her to thinking more about how this minimum was established close to 30 years ago, about 1993. And with all the inflation that we've seen over the past 30 years, she wanted to make sure the minimums match that. So that's where the bill comes from. Again, it comes from a constituent of mine, and she did submit some written testimony on it. So thank you, Chairman.
Thank you. Are there any questions for the sponsor? Representative Phillips.
Thank you, Chairman. Just a quick question. I do know that a lot of people will either have uninsured or underinsured, like you had stated in this bill here. But for very inexpensive money, I think there is underinsured or uninsured, like a rider or something policy, because I've had that too, and have hit and runs and everything else in my career of driving. I've not even in the vehicle. I come out and see my car hit, and it's like, so the uninsured or underinsured or hit and run covered, and it cost me, I think, $40 or $50 a year for that coverage itself. Has she taken into consideration that?
So that's a great suggestion, and she actually does have that. And she mentioned, I think she might mention it in her written testimony. I know she mentioned it to me when we connected on this bill idea, but her thinking was if you don't have that, you're not protected. So that's why she asked me to sponsor this. But great suggestion, absolutely.
Are there any other questions for the sponsor? Seeing none, thank you for your testimony. As you stated, we have received written testimony against from Allstate and then in favor from Kimberly Massaraco, who just want to read a quick line from Kimberly's testimony. In 1993, the average cost of a brand new car was $15,000 and the minimum wage was $4.45 an hour. So it's just something to think about in regard to this. And that concludes the testimony on House Bill 5512. Next, we will go to Representative Potter's Bill 5773. an act relating to public utilities and carriers, duties of utilities and carriers.
Thank you, Mr. Chairman, fellow members of the committee. So this is a pretty simple, straightforward bill. This came to me, like with Kazarian's, by request of a constituent, somebody who is very concerned about the frequency of dealing with power outages, and somebody who is on a life-saving medical device. So this would require National Grid or any public utility to maintain a registry of customers who utilize a life-saving device and prioritize restoring service at their homes in the event of an outage. Pretty straightforward, pretty simple. The only opposition that I saw to it was from National Grid. And I think the premise of their claim for why we don't need to act on it is that they're already putting that practice into play, to which I would say, well, if that's already their process, there's no harm, no foul in codifying that into law and making sure that it's actually regulated. So with that, I'm happy to take any questions.
Are there, Representative Fin Fung?
Thank you, Representative Potter. So I didn't know that they were keeping a registry of all that. I put this into work when we talk about, I used to do home health care quite a bit, okay? And we'd have patients that come on hospice, or we have somebody on a lot of oxygen or whatnot. So we were always using the fire department and whatnot, getting them on the disability list, and there's a registry. It takes a lot for a family that's already going through a lot from a medical perspective to then think, I got to call the fire department, I got to call National Grid, I got to call this. It's just unlikely to happen, especially when things are moving quickly at the home environment. I know that we have the disability registry here in Rhode Island. I think it's underutilized, probably just from a public awareness type of thing. I would love, just from a pragmatic standpoint, not a philosophical one. I get you right there, and I'm with you on the philosophical. Pragmatically, I just don't see them ever calling National Grid. Like, it's just not something that a family would usually do. Especially when they're in these type of situations. I wonder if the disability registry can talk to National Grid, or if we can just have a star. I don't know how we do this with HIPAA and everything, but I feel like some people are going to fall through the cracks. And I know Whip Kazarian has brought up this issue a lot in East Providence, especially when it comes to public housing. We got to find a way to simplify it, especially when you're thinking of an 80-year-old adult who's coming home on oxygen, new meds. This is the last thing they're thinking about. So I love the idea. I just pragmatically, I don't see this working, but I think it can work with a little bit just some agencies talking to each other, which is a whole different kind of joke in and of itself. But
it's the intention of the bill to not put the burden on the consumer, so that they wouldn't have to be the ones actually reaching out to National Grid and asking for this service to be restored. It would be National Grid keeping a registry of people who are on life-saving devices and then being proactive in restoring their service in the event of an outage.
Oh, I understand that for sure. I just don't know how they get on that registry. That's the part that I feel like that will fall through the cracks, unless it's the home health agency. We're saying, we would always say, all right, make sure you notify the fire department. So in case there's a fire, they know that grandma's upstairs in the back bedroom, and they can kind of prioritize how their plan of attack there. There's a pragmatic issue right here, and it's not your fault, and it's not National Grid, it's not anything. I just feel like if we really want to maximize how it's going, I think we really got to get the disability registry to kind of talk here. And like I said, in that way, we get to the point of your bill and making sure that everybody's covered. All right, so I appreciate it. Thank you.
Are there any other questions for the witness? Seeing none, we're going to go to Hank Webster from Acadia Center. Hank, you are before the House Committee on Corporations. You may proceed with your testimony.
Thank you, Chair. My name is Hank Webster, and I am the Rhode Island Director of Acadia Center. We're a clean energy research and advocacy nonprofit. And I just want to say thank you and applaud this bill. I do have one idea that I would like to offer, and also I was able to pick up a little bit of the conversation directly preceding me, but not the complete thing. I think this is a really good idea and important, so that in the event of a storm outage or something like that, National Grid has a good comprehensive list of folks that are on medically necessary equipment and can focus their outage restorations there. The one thing that I would think of to perhaps take this to the next level is thinking about implementation of a battery storage program. So there are a lot of states around the country that are starting to think this way. National Grid is as well. That if you have a battery storage device in your home, the most common commercial one is probably a Tesla Powerwall. That you can connect that to the grid and it can provide backup energy services. And when I think of this, I think of an opportunity to prioritize the investments at people that might have chronic medical concerns. So I heard a little bit of Rep. Fenton Fung's testimony or question about sort of more of those new medical concerns. If someone's coming home from hospital or rehab, this might not be on the top of their list of things to call up or sign up for. But in the case of someone that might be chronically in this situation, I think it's a really good idea to get on this registry. And if we can direct investments in battery storage to households that National Grid is aware of, that are on that list, then that's a really good benefit. If it takes them a little bit longer to get out to restore an outage, we know that patient has some other options for power for their medically necessary devices. Vermont has a battery storage program that they've actually implemented with their customers because so much of it is rural that it was able to help them do some restoration of power and services quicker than they might normally be able to with downed poles and wires. So there are models for this. I appreciate the context of the bill and just wanted to offer that one piece of information in case there are further discussions.
Thank you.
I'd be happy to answer any questions.
Thank you for your testimony. Are there any questions for the witness? Seeing none, if you could just stay on the line for a moment, just hang tight. We have received written testimony against from National Grid, and then we've received written testimony in favor from Meg Armstrong, and that concludes the testimony on House Bill 5773. I'm just going to jump very quickly to Representative Tabone's bill, which would be 5514. This act would require public utilities and electric distribution companies to provide prompt and adequate service to its ratepayers relating to new service and service upgrades, subject to a penalty of up to $10,000 per violation. Electric distribution companies would be required to provide upon written request estimates of any work to be performed of more than $500 and an itemized bill for work performed for any fee payable by the ratepayer. Hank Webster, would you like to continue to testify on this bill?
Oh, sure. Thank you. So I think I'm neutral on this bill. I support the intent. There's a little bit of it that I think might have an unintended consequence. So Acadia Center has concerns about the expansion of gas service throughout the state. We're really at a point where the climate science and more importantly, perhaps the health research has concluded that the use of so-called natural gas is incompatible with state climate goals and is hazardous to public health. The UCLA School of Public Health has put out studies, the Physicians for Social Responsibility and others, that find that gas combustion, particularly when you're thinking about gas stovetops, is linked to severe respiratory and cardiac illness because of the fumes and the off gases. And it's particularly problematic in children that are exposed to this. Their respiratory rates are higher, their organs are still developing, and the problem gets yet worse as living space gets smaller. So this can be an equity issue, it can be an environmental justice issue. The more confined the space, the less fresh air there is, and the greater proportion, obviously, that these fumes are. So I know that that's probably well beyond the intent of this bill, which is really just, I think, to focus on some customer service and some transparency in the connections. But and while this bill is geared towards that, and that is a good positive development, we want to avoid giving the utility additional justification to continue expanding their gas infrastructure. And really, we should be looking at cleaner alternatives. So that's all I wanted to say about this. I'd be happy to answer any questions the committee may have. Again, recognize that it wasn't the direction or the intent of the bill, but I just wanted to raise it to folks' attention.
Great. Are there any questions for the witness? Hearing none. That concludes the verbal portion of House Bill 5514. We have received written testimony against from Verizon. And that concludes the hearing on House Bill 5514. Going to go back to House Bill 5771 by Representative Potter.
Thank you, Mr. Chairman, fellow members of the committee. So Bill 5771 would put a moratorium on the Department of Health or any other state agency, prohibiting them from issuing a new license for any live market or wet market as they've become known to be known of in the age of COVID. For those of you who are not aware of what that phrase is, a live market is a retail establishment that sells live animals and then slaughters them upon site upon demand of customers. There's a number of public health risks associated with the practice, specifically relating to the spread of zoonotic diseases. Really the combination of having a variety of animals that are being held in close confinement with one another in stressful situations and having close contact with humans is a really dangerous recipe for the spread of disease. And despite the issue not really getting a lot of attention until the aftermath of COVID-19, the history of the health risk predates the current pandemic, where we can point to H5N1 bird flu and SARS, to name a few of other infectious diseases being thought to have originated in similar environments. Now, it's not just an issue in China. There are a number of medical doctors and experts in the field who have done a lot of infectious disease research and have submitted written testimony in support of this bill. One of whom I'd like you just to direct your attention to was Dr. Michael Greger, who is a New York Times bestselling author, where he elaborated right now, quote, highly pathogenic avian influenza, which threatens to cause the next global pandemic, is currently spreading through chicken farms all over the world, but a likely route of transmission to humans is at live markets. There, live markets are in close contact not only with the workers in the market, but also thousands of customers, and each human interaction provides a chance for the virus to cross species barrier. Live poultry markets have been implicated in the emergence of avian influenza viruses with pandemic potential. I'd also like to direct you to the testimony of Dr. Neil Bernard, professor at George Washington University School of Medicine and the president of the Physicians Committee of Responsible Medicine, where, quote, in 2015, the CDC reported findings from 2 live animal markets in Minnesota with clear evidence of animal-to-human viral transmission of an influenza A virus. The virus was identified not only in the animals, 86%, rail samplings, 24%, and air samples, 67% of the market, but also in 65% of its employees. It was also detected in a market customer. So this bill would simply just put a moratorium on the issuing of any new license. It specifically and intentionally includes language to say that it does not affect any existing business. So while we've received some testimony I was made aware of in opposition to the legislation, as if more live markets are what we need right now, kind of escapes me. But I do want to point out that in the testimony from the RI Farm Bureau, they made it a point to say, quote, the World Health Organization has still not determined the origins of COVID-19 in China, to which I just have to express my concern. Respectfully, I don't think that we have room right now in public policy for science denial. I think this is a responsible step for us to take, and there's a lot of scientific and research data that's available. I'd be happy to share it with the committee, and happy to take any questions that I'm capable of answering.
Thank you. Representative Fenfung.
Thank you. Representative Potter, how many wet markets are there in Rhode Island?
To my knowledge, it's only one.
Okay. So there are certain cultures where live markets are an acceptable part of their culture. It's not the acceptable part of American culture, by and large, okay? I think there was some concern. There was a large Chinese market in Providence that opened up a few years ago, and they had a practice which was very consistent with their culture, but turned off some people because of that practice and whatnot. We were just kind of looking at some of the language here, and we don't have to get into the COVID stuff. That's not part of this bill. But when we're looking at here, I mean, it could be very widely interpreted as saying, like, you could get fish. You can't get we get fish sold live all the time, lobsters or whatnot. There's some language in the bill there that would definitely need to be tightened up. But I would just open your mind to the fact that in some cultures, okay, like live markets are part of that culture. And we have to at least acknowledge that, and maybe not be so close-minded when it comes to just respecting parts of different culture, even though it might not be acceptable to us. Okay, thank you.
Are there any, Whip Chippendale?
Thank you, Chairman. Yeah, certainly the one live market that we have is the one that popped into my mind when I saw this bill. First, I'll say that there's no place I'd rather go to get a fresh goose than Antonelli's. But I don't even have to do that. I can just go over to my neighbor's house. I used to have broilers in my yard. I would raise them, feed them, slaughter them, process them, and eat them. Nobody died. People haven't died from Antonelli's. There's been no outbreak up on Federal Hill of any flus or anything like that. I think this is because the thought of poor little chickens dying makes people feel icky. But the sad reality is that you got to kill it if you're going to grill it. And whether it happens at a live market or in a massive factory somewhere that is out of sight, so therefore it's okay, and then shows up shrink wrapped at Stop and Shop, there's not much of a difference. In fact, I would argue that were there an outbreak of any sort of a disease, which clearly we've only seen happen on very few occasions, that it would be more likely in one of the larger facilities that produces tonnage of meat, as opposed to a small little mom and pop place that's been up there for 4 generations doing what they do without harming anyone. That's my 2 cents. Thank you.
Thank you, Whip Chippendale. I don't normally allow for a response, but Representative Potter, is there something that you want to add?
Thank you, Chairman. I do appreciate it. I would just say to a few of the points, and I'll be brief. Rep. Fenton Fung, I appreciate the cultural implications, and I think we need to be mindful of cultural dynamics. I also don't think that cultural dynamics are what we need to have override public health policy. I think that's a line where us as legislators need to craft our policy in the best interest of the public health. And unfortunately, there might be some cultural concerns that come into place at that point, but that's a balance that we have to weigh out, and that shouldn't take priority. And I would say to Representative Chippendale's point, I get the read on it about, I think you said little chickens dying. It's really not so much about the slaughter per se of the animals, it's the close contact of having a retail establishment where the public can be in close proximity to these animals while they're stressed out, while they're being slaughtered. I've never been in the establishment that you referred to, but how I've been told about it is that the general public can basically walk into this facility. There's a number of varieties of animals stacked in cages next to each other. Cages are littered with feces and waste, and you have human interaction from not just the people that are working there, but consumers going into it. It's a recipe for a public health risk. There's a lot of data that suggests that, and there's been a lot of evidence to it. So I would just encourage you to, maybe I can forward you some of the information and the research that I've looked at, and we can talk about it at another time.
I would be happy to read anything you can forward to me, and I would offer to you the opportunity to come up to my district, and you can check out some of the poultry processing farms and some of the beef processing farms and see it from stall to freezer for yourself and see that it's just the way it goes. Thank you.
Okay, we have David Dadakian on the line. Who's going to be testifying on this bill. Mr. Dadakian, you're before the House Committee on Corporations. You may proceed with your testimony.
Thank you. Thank you, Mr. Chairman. Thank you to the committee for hearing me tonight. Thank you very much to Representative Fenton Fung and my Representative Chippendale for your comments. A lot of what you just said was things that I was going to say, so I'm going to keep mine brief. I run a company called Eat Drink Rhode Island. I work with a lot of farms around the state. I primarily have been with Blackbird Farm for 13 years. We raise beef and pork. I'm opposed to this bill for a lot of reasons. But listening to the testimonies that's been going on, I think I'm going to speak to exactly what was just talked about. To use Representative Chippendale's example, I don't know if Mr. Representative Potter knows this, but at a large corporate facility, slaughterhouse out in the west or in the south, the USDA allows birds to be killed 3 per second. And then those birds are packaged and sold fresh, and that's essentially a live market. That's not what happens at Antonelli's or at any type of live market that would be in this area, which we don't have anything that would approach the level of danger that's being described here. And if anything, having personally done slaughter, either with the bolt gun or the knife, and I can take you through the whole process if anyone's interested, it's much safer to freshly slaughter something and sell it in that case than to go through a process like I just described with 3 chickens per second, 24 hours a day being killed. And not to get too graphic for you, but regarding the comment about feces and things of that nature, I don't know if you're aware of this, but the first thing you have to do after you kill an animal and bleed it out is to remove its digestive system. And hate to tell you, but there's feces in the digestive system of just about every animal that is being alive killed. So that is clearly not a problem for thousands of years of slaughtering animals. I want to go back though to the issue of COVID and China and all of that. We have these 2 organizations here in the United States that may not always be culturally sensitive. I like Representative Funk's point very much, but you may have heard of them. It's the USDA and the FDA. So we can't even have markets of this nature in this country. I don't understand these bills that are legislating something that doesn't exist and is not an issue. I'm not debating the source of the COVID infestation, pandemic. It happened through an infestation with bats. We're not going to debate that. Science can prove that. But that is not something that is happening here at any level. And a live market is certainly not comparable in any way, shape, or form to that type of exotic game wet markets that are involved in other countries. And to be quite frank, 99.9% of them are done safely. Unfortunately, this one caused the COVID pandemic, and then there was a lot of things on top of that which caused the spread. So again, I would be happy to take any questions if anyone wants to learn more about slaughter. I'd be happy to teach you about that, and I thank you very much for your time.
Are there any questions for the witness? Representative Potter, you are a member of this committee, so you are entitled to ask a question of the witness.
Thank you, Mr. Chairman. I appreciate that. Mr. Dedekian, you testified that in these massive industrial operations across the country, birds are killed at a rate of 3 per second. Are any of those birds in those operations killed in front of the general public?
Well, if you consider the 100 of workers that are standing in these facilities, I would consider those members of the public. It's no different standing behind a counter at Antonelli's or standing in front of hundreds of birds being slaughtered per minute. They're people. They're human beings. Pathogens can travel. But in 99% of the cases of meat recalls in this country, it comes from those large processors, Cargill, Smithfield, et cetera. And frankly, we've never had that incident in Antonelli's or any small market in the general area that I've been to. I could check health department records if we're, to make sure I'm 100% correct on that. But I have been working in the food industry here for 15 years, almost 20 years, and the only recall that I can recall locally was a slaughterhouse in Massachusetts. One had a burger issue, which was quickly fixed, and Daniele up in Burrville had a salmonella in the pepper spice that they bought from another supplier issue, and neither of those were related in any way, shape, or form to slaughter.
Okay, so we can agree then that other than employees in those factories, those birds are not being slaughtered in front of any other members of the general public, right?
Sure.
Okay. And you also testified that, in your opinion, it's much safer to operate these type of live markets and slaughter them rather than how they're slaughtered in industrial operations. Do you have any professional background in public health?
Again, working in the food industry and working with the health department for the last 15, 20 years. And having done slaughter personally myself and observing all the absolute necessary rules for slaughter, having certification for serving and cooking food, I'm not a health official, no. Thank you for asking a question you know the answer to.
Okay, thank you for your testimony. Are there any other questions for the witness? Hearing none. That concludes the verbal portion of the testimony on this bill. We have received written testimony in favor from the Physicians Committee for Responsible Medicine, Aisha Akhtar, the Center for Contemporary Sciences in favor. We received written testimony against from Anita Bruno, Eat Drink Rhode Island against, and the Rhode Island Farm Bureau against, and we've received comments from DEM, written testimony. And that concludes the testimony on House Bill 5771. Representative Potter, we have House Bill 5772, the Rhode Island Healthcare Reform Act of 2004 Health Insurance Oversight, which would require Health Insurance Commissioner to adopt a uniform set of medical criteria for prior authorization and create a required form to be used by a health insurer. Representative Potter.
Thank you, Mr. Chairman, fellow members of the committee. So yeah, pretty straightforward. As Chairman Solomon mentioned, this would have the Office of the Health Insurance Commissioner create a standardized form to require all insurers to accept it for prior authorization. Right now, these forms vary, from what I'm told, quite substantially from carrier to carrier. And from speaking to healthcare providers, one of the most common challenges they share is how much of an administrative burden they have that ultimately gets in the way of them doing their job in providing care to patients. So when providers are doing too many things other than patient care, ultimately we can recognize that the patients are the ones who suffer the most. So this would simply just streamline the process. It would make it easier for providers. It would allow patients to get approved quicker for the care that they need, and it would help providers be able to better focus on the health of their patients rather than administrative work. It's worth noting we have standardized billing forms and standardized codes already in place. And again, I know all the healthcare providers that I spoke to were very much in favor of it. So with that, happy to take any questions, and I hope the committee will seriously consider it.
Are there any questions for the sponsor? Seeing none, we have received written testimony from the Americas Health Insurance Plans with comments. And that concludes the testimony on House Bill 5772. Next, we will go to Representative Fenton Fung's Bill 5904.
Thank you, Chairman. So 5904 helps to kind of fix a gap in care right now for children and adults with dyslexia. One of the interesting things is that in the past, dyslexia was not seen as an actual medical disorder. They termed it as a learning disorder. A bunch of new research in the past 10 years actually has gone to new thinking. In 2020, Italian researchers actually were able to look at, well, this is some disgusting app around dinner time, postmortem brains and actually see anatomical differences in the brain structure of people with dyslexia. There have been advances in genetics where they're actually noticing 3 different areas on chromosomes 15, 1, and 3 that run in families with dyslexia. And researchers just last year in the UK, Canada, and Italy studied the imagings, MRIs, PET scans, and showed that the dyslexic brain fires very differently than someone who's normal neurofunctioning. So between the anatomical differences, genetic findings over the past 2 decades, and the abnormalities that we're seeing on these screens now, it's really time to stop calling this a learning disorder and realize this is a neurodevelopmental disorder, as previous research just last year concluded. And we should be treating it such when it comes to health insurance. We know that children with dyslexia, when they're identified early and come up with a good treatment plan, they actually tend to do very well. We have members of this legislative body who are dyslexic, and because they had treatment early on, are doing very well. We also know that it affects more than just reading. Actually, it affects the way that we learn mathematics. So in order to get great kind of assessment by professionals, we usually send them for a neuropsych eval. Neuropsych evals have not been covered by insurance because they term dyslexia not a medical disorder. I think new research obviously shows that in a different light. The results of a neuropsych eval really help teachers plan for each one of these kids' individual learning disabilities and treat it very early on. This bill would provide coverage for up to 10 hours of neuropsych evaluation. They bill it on an hourly rate for dyslexia. I talked to many different neuropsych physicians. They said that most of the time they would be able to complete a thorough eval in 6 to 8 hours. Some of them, though, would be up to 22, just depending on how complex the case was. We kind of came up with 10 as a nice little area of agreement in between. And anything above that would be the responsibility of the family. These evaluations are actually very expensive for a family. It'll be in the thousands of dollars usually. The rates around here in Rhode Island are between $150 and $400 an hour. So especially for our children who are living in lower and middle income families, this might not be an option without health insurance. And I think, obviously we treat this early. They end up much better outcomes educationally later on. I think this bill helps to kind of find a nice little middle ground with the 10 hours of insurance coverage. So with that, I'm happy to take any questions. Thank you.
Thank you. Are there any questions for the sponsor? Representative Shallcross Smith.
Thank you.
I'm just wondering, would you be willing to go more than 10 hours? Because 10 hours seems...
I'm happy to. We were just talking to the different doctors and whatnot, and they thought all right, some of them even said, you're going to get doctors to say I'll have to do a 20-hour eval every single time. And they kind of giggled. They probably didn't need a 20-hour eval every single time. So I think they were trying to find a ground where they wouldn't see an abuse of a system per se. But I'd be happy to talk to you and maybe put you in touch with some of the doctors and see if we can come up with a fit around. Yeah. Thank you so much.
Thank you. Are there any other questions? Hearing none, we have received written testimony against from the AHIP, and that concludes the testimony on House Bill 5904. Next up, we would take up Representative Marzlikowski's Bill 5770 regarding sanitation in food establishments. This would exempt residential kitchens providing baked goods for sale from the provisions of the general laws relating to farm home food manufacture. We have received written testimony from the Rhode Island Hospitality Association against, as well as a written testimony from the Rhode Island Department of Health with concerns. And that concludes the testimony on House Bill 5770. Next, we have House Bill 5907, an act to vacate the forfeiture or revocation of the charter of New England Real Estate Marketing Services Incorporated. There is no testimony on this bill, and that concludes the testimony on House Bill 5907. Last up, we have House Bill 6068 by Chairman Casey. This would vacate the forfeiture or revocation of the charter of Rainier Associates Incorporated. There's no testimony on that bill, and that concludes the hearing on that bill. Is there a motion to adjourn? So moved,
Second.
seconded. We are adjourned. Thank you.
Chair.